The reason that we've picked this topic for this afternoon is because it is the leading cause of death in deprived areas. It causes, in fact, it causes a quarter of all deaths in the UK, full stop, 25%. And we're talking about cardiovascular disease, otherwise known as the acronym CVD, or in plain English, heart and circulatory disease. And we know that by working together, preventing and finding and treating this illness, we can help people live longer, happier lives, well, longer, healthier lives, which is a key tranche in the Leeds plan. So today's all about learning from each other and from what's already going on. Everybody here will have a different level of knowledge about CVD, but we all have a part to play in prevention and early detection. So we've got three main contributors to our meeting this afternoon. We're going to be hearing from public health colleagues with awareness raising about this topic. We're going to be hearing from West Yorkshire colleagues about what's happening on a regional footprint. And then also we're going to come down locally to hear from local colleagues about practical initiatives that are happening right here in Leeds, in Bermtoft Hales, Richmond Hill area. Sometimes we do introductions, but I am going to make a call that because we've already got 30 people in the meeting, that's going to be a bit impractical at this point in the meeting. After we've had our three presentations that I was just ran through there, we're going to, as true Hatch style, going to break out into groups to have some discussion. And I suggest at that point, if facilitators could obviously get everyone who's in there breakout room to introduce themselves, and that's how we can do it. It's really important to us that everybody who comes to Hatch meeting feels firstly welcomed and also make some good contacts and a good network. So if you meet somebody that at a Hatch meeting that you think would be useful or good to know about, please contact them afterwards, and we can put people in contact with each other if that would help you. Our Hatch meetings are always as interactive as possible. Please keep an eye on the chat function. If you've got any questions or comments, then please post it in the chat. Facilitators and myself will be keeping an eye on that and getting responses for you. Use your emojis to react to what you're hearing and so on as well. Great to have your camera on if you can, if you've got the bandwidth, especially if you're speaking. But otherwise we might ask people to turn them off if things go wobbly, but otherwise it's great if people can have their cameras switched on. Okay, so that's the end of my introduction. As I say, it's good to have so many people here, 32 this afternoon so far, so that's great. So we're going to start with our first presentation this afternoon from Lydia Robson in the public health team, health improvement specialist for long-term conditions. She's going to be setting the scene around exactly what is CVD and look at the risk factors and what we can all be doing to support heart health. So Lydia, can I hand on to you?
Hi everyone. Yes, hi everyone. I'm Lydia. I've just shared my screen, so hopefully that comes through for everyone. Wonderful. And I won't be able to see the chat in that time, so if anyone wants to jump in, please do. But yeah, as mentioned, I'm Lydia. I work for Leeds Public Health as a health improvement specialist in the long-term conditions team. So we cover a range of long-term conditions, but my remit is mainly around heart health. We do lots of work on both prevention and management of long-term conditions, but today I'll be giving a bit of an overview about heart health and cardiovascular disease from a prevention angle mainly. So apologies, this may be familiar to some of you, but just to kind of go back down to basics. So what is cardiovascular disease, or CVD? So it's a general umbrella term for conditions affecting the heart or blood vessels. It can cause acute events such as heart attacks or strokes, and can be associated with other conditions and damage to arteries and organs such as the brain, heart, kidneys and eyes. In terms of the scale of the problem, cardiovascular disease is the leading cause of death worldwide, accounting for nearly 18 million deaths each year, which is about 31% of all global deaths. So yeah, a huge public health issue. And as mentioned, it can cause lots of other conditions, events, so heart failure, chronic kidney disease, onset of vascular dementia, as well as heart attacks and strokes. And it's one of the main causes of death and disability in the UK, and can affect more deprived areas more so, but can often largely be prevented by various factors, which is good to know, which I'll come on to. So that was the scale globally, but in terms of locally in Leeds, CVD is also a prominent issue. So you can see from the figures here on the screen, It affects lots of people in Leeds in terms of having hypertension, which is the medical term for persistent high blood pressure, coronary heart disease, atrial fibrillation, and you can see from that bottom figure that 15,000 people had a stroke or trans-ischemic attack in 2020-23. So yeah, really big issue in Leeds. And on top of this, we know that there's about 100,000 people who have high blood pressure, which is a significant risk factor for CVD, but they don't know it. So therefore, they're not receiving the treatment they may require and may not be aware that they need to be making lifestyle changes accordingly. So this slide is showing the number of premature deaths from circulatory diseases for people aged under 75 nationally. And we can see that generally circulatory disease has seen a steady downward trend, more noticeably in our deprived communities, which is closing the gap between our city average and Leeds, which is really positive. However, Leeds rates do remain above Yorkshire and the Humber and national rates for England. And as mentioned, people from our more deprived populations are nearly 4 times more likely to die prematurely from CVD compared to people from more affluent areas. So this is a scarf chart, which shows the percentage contribution of the cause of death of different conditions, and that contributes to the gap in life expectancy between males and females in Leeds. So we can see for men, circulatory diseases make up 28% of the life expectancy gap between most and least deprived, and for females, they make up 24% of the life expectancy gap. So yeah, really large figures, and you can see it compared to some other causes there. So just another visual for you to show the mortality rates in Leeds for circulatory diseases, the red areas being areas of greater mortality. So you can see I know it's not labelled, apologies, but the areas around Hatch are some of the most affected, and I'll come back onto that a bit later. But yeah, just some visuals to kind of show the scale of the problem in Leeds. I also just wanted to draw attention to the ethnic differences in mortality for these 4 conditions on the slide here. So heart disease, stroke, hypertension and diabetes. So all conditions that affect the heart and circulatory system. So generally people from Black African, African Caribbean and South Asian heritage are at higher risk of at least one of these conditions, which is really important for us to consider when we're looking at how we can implement public health initiatives to reduce the population's risk. I can share all these slides after as well if anyone's interested in having a bit of a closer look at these. So in terms of risk factors then that will increase a person's risk of cardiovascular disease, there's lots. There's behavioural risks and social and environmental factors. So thinking about the behavioural risks, smoking is a really significant one. Diet and obesity, particularly excess salt in the diet, is particularly harmful, as well as lack of fresh fruit and veg and excess alcohol consumption. Physical activity also really important, or rather inactivity, and more of a stress and deprivation level can really play an important role in increasing your cardiovascular disease risk. So those are things in the sort of social and environmental factors, things like pollution, poverty, yeah, so these are all things that can arguably, or at least the lifestyle factors can be modified, but there are some risk factors that can't be changed. So things like your age, so your risk increases with age, particularly when you're over 40. Your ethnicity, as we've already mentioned. So if you're from Black African, African Caribbean and South Asian heritage, you're at an increased risk generally. Genetics, so if you've got family history of CVD, particularly from an immediate family member, your risk is also greater. And gender, so men more likely to have CVD compared to women generally. But as I say, it's a big umbrella term, so it will differ depending on which condition you're looking at in more depth. So more locally then in terms of risk factors, so apologies, it's a bit of a busy slide, but this map shows the number of people in Leeds by ward who smoke, live with obesity, and don't already have a recorded blood pressure reading on the clinical system, so they haven't got a diagnosis, and are living within the most deprived 10% per ward. So we can see from this that in Hatch, there are high numbers of people with these risk factors. Yeah, again, can circulate this out so you can see in more detail. But if you don't include deprivation as well, it's even higher. So for BHR, it's just under 4,000 people with all of those risk factors together. Gipton and Hare Hills, it's about 4,700 people. And Chapel Allerton and Chapeltown, it's about 3,500. So yeah, really stark figures. So in terms of what we're aiming to do about it and nationally, the kind of goals around cardiovascular disease. So NHS England sets out some key ambitions for cardiovascular disease. First of which being that people should routinely know their ABC numbers, as they call them. So that's your atrial fibrillation, your blood pressure and cholesterol. That are all risk factors for CVD. Secondly, working with partner organisations to increase the number of people who know their ABC numbers is really important, and improving the effectiveness of existing approaches such as the NHS health check to treat people with high-risk conditions, which I'll come on to talk a bit more about in a minute. There's also CVD Prevent that some of you might have heard about, which is a dashboard that extracts routinely recorded GP data, which makes it easier for practices and PCNs to systematically identify people who whose treatment could be improved and therefore they can be risk reduced. So again, I think that's going to be mentioned a bit later on by my colleague Laura. And yeah, ultimately supporting early identification and management in order to prevent complications, improve people's quality of life and patient outcomes, and reduce healthcare costs too. And it's estimated that reducing risk factors for cardiovascular disease and treating people accordingly, the aim is to prevent 150,000 events like heart attacks and strokes over the next 10 years. Yeah. So moving on then. So yeah, we know that early identification is really important to prevent all these issues. Therefore, just wanted to highlight some of the work we've been doing recently in public health around raising awareness of CVD and encouraging people to get checked through various mechanisms. So firstly, we've got the NHS Health Check programme, which is a free preventative checkup for adults aged 40 to 74. People are invited every 5 years, often to their GP, and it screens for heart disease, diabetes, kidney disease and stroke. So this is a national programme that's implemented and delivered here in Leeds. And I think a colleague may go on to talk a bit more about the local approach with the health check later. So we've also recently delivered a community blood pressure grant scheme in the South Leeds. That was between January and March of this year, whereby small third sector and grassroots organisations applied for fairly small pots of money to deliver blood pressure awareness raising and checks in community settings. So the evaluation of which is currently being written, but we can see this has been really successful in reaching hundreds of people from the forms that we've received back so far for relatively little money, and has made some real impact, looking at some case studies in people's real lives where they've gone on to see that they've had initial high reading, gone on to get checked, and are now receiving the care that they need. We're also in the process of delivering a project in Seacroft alongside the PCN there and third sector partners, where people are having their blood pressure checked either in community settings by third sector partners, and then if they have a high reading, they're being supported by a specialist team in the PCN to really offer that person-centred care and reduce blood pressure. And then a second strand of that is that the PCN are able to, they've identified people at high risk based on risk factors that are captured via their clinical systems. And then they've invited those people to have their blood pressure read and have at the same time offered that supportive pathway for people with high readings. So that's ongoing, going to the end of this summer. That's been a really positive way to look at different approaches to blood pressure testing, essentially. We also commission in Leeds the Leeds Health Awareness Service, which is a community-based service working to reduce cancer and long-term condition inequalities by sharing various prevention messages, raising awareness out in communities of the various signs and symptoms, risk factors, and promoting uptake of support out there. So various screening services, the NHS Health Check, and some wider support to like the Stop Smoking service we have in Leeds. We also have the Migrant Access Project team based in the council that we've done some really good work with in the last couple of years to raise awareness of long-term conditions amongst migrant communities. So through this project, they have a network of local champions, basically, called Migrant Community Networkers. And they're from various communities, speaking various languages. They put in bids for some small pots of funding to run events for their local communities, raising awareness of cardiovascular disease. And there have been several iterations of this partnership project. But last year, we had 13 migrant community networkers, and they reached 372 people from a vast range of communities and in a vast range of languages. So again, another really positive example of some partnership work we've been doing. And then finally, but it's not an exhaustive list, we've got lots of work going on for diabetes prevention too, including promotion of the NDPP, or National Diabetes Prevention Programme, for people at high risk of diabetes type 2. There's been lots of work on gestational diabetes, improving pathways there, and several awareness raising campaigns, which I'll come on to talk about now quickly. So yeah, again, in public health, we've worked with various partners to deliver multiple comms campaigns around heart health. And as a result, we've got some fab resources that can be reused and shared more widely, which you're, depending on where you're from, or what your kind of angle is, you're more than welcome to use as well. So working with our NHS and localities colleagues, we produced some diabetes videos in 5 different languages, Punjabi, Arabic, Roma, Bengali and English, to explain risk factors of diabetes, signs and symptoms, busting some myths and kind of where to seek support. So those have been shared out in communities, but we'd like to get them out even wider. So we also did a blood pressure wise campaign where we shared various messages across social media. We had posters at bus stops and various digital and physical billboards across Leeds, all encouraging people to get their blood pressure checked at community pharmacy, which is a wide offer at most community pharmacies. And then just to say, we're currently producing some NHS health check videos, again in multiple languages, so English, Polish, Romanian, Punjabi and Urdu, explaining the process of the health check and sharing some experiences as to why it's important and the benefits. So watch this space. And moving on to my final slide. If you're interested in supporting heart health of your local population, there are, several ways that you could get involved. I think it's worth noting there are some really helpful resources out there, and we're really fortunate in Leeds to have the Public Health Resource Centre, which is based in Chapel Allerton on Harrogate Road. And it's a completely free library full of some brilliant public health resources spanning across loads of different topics. So it's got leaflets, booklets, some interactive games and models. And they've got an online catalogue if you ever wanted to have a look at what they have, and their email address is on there. If you were to order any resources, you just need to email them. But we also have a blood pressure specific resource pack that we can share with anyone who's interested, which has got a list of relevant resources that you may want to use depending on the nature of your work, and even for signposting people. So some of these are digital, including some of the videos that I mentioned on the previous slide, and any physical copies also are available from the Public Health Resource Centre. We also do have a small number of blood pressure machines that can be loaned from the Resource Centre too. So again, depending on any kind of work you might particularly want to do, or just even setting up like a small area where people can use the machines themselves, that's something that we can absolutely support you to do, and use that kind of small number of machines that we've got at the Resource Centre. But yeah, I think it's just really important as well to be aware of the mechanisms that people can have a blood pressure check, as that's one of the kind of biggest cardiovascular disease risk factors and ways that you can kind of understand your risk. So many pharmacies, as mentioned, offer free blood pressure checks. There's the NHS health check for eligible people, so age 40 to 74 and don't have a pre-existing long-term condition. And then some GP GP practices have some pods in their waiting rooms that people can drop in and use, and again varies depending on which practice people are from. But that's it from me. I'll stop sharing. Thank you for listening, and if you have any questions, please do let me know either now or feel free to get in touch at a later date.
Thank you, Lydia. That's great. I got one question.
Yeah.
Your ABC numbers, which is a really nice way to remember it. What does atrial fibrillation mean?
So atrial fibrillation, it's to do with your pulse. So it's about the kind of regularity of your pulse.
Okay.
So yeah, essentially those three, so blood pressure, atrial fibrillation, and cholesterol are kind of three of the main risk factors. But yeah, can share more information on that.
Atrial fibrillation starts with an A rather than a P, doesn't it? So it's a pulse check,
Yeah.
a blood pressure check, and then a blood test to test your cholesterol. Those are the three numbers. Great,
Yeah.
Thanks. We have a BP pod here at St Martin's, actually, if anyone wants to drop in and use it. It's in our waiting room. Any other questions for anybody at this point for Lydia before we move on? Do just raise your hand if you've got a question you'd like to ask, or drop it in the chat. Otherwise, we will move on. Thank you, Lydia. Oh, Ruth's got a question.
Yeah, there was a question in the chat from Dominique. Are there any easy read versions of the materials you mentioned at the end there, Lydia?
Yes, for some of them. So when I share that resource pack, that will probably make it a bit clearer as to some of them have easy read versions, some of them don't, unfortunately. But yeah, I can absolutely share that, and you can see which ones might be more appropriate.
Thank you.
Thank you. Okay, so we're going to move on now to zone out a little bit onto what's happening across West Yorkshire, and I think we have Laura Williams with us, the programme manager from West Yorkshire ICB.
You do. Hi, Camilla. Hi, everyone.
Hello, Laura. Hi.
Thank you for having me. It makes a nice change to be able to come into one of the places and see kind of who works where. And thanks, Liz, for suggesting it. I've just popped a link into the chat as well for a resource that I know is definitely easy read that Bradford Talking Media developed, and there's an array of other resources on there for both professionals and for patients. So just in case that's of any use across the spectrum of cardiovascular disease conditions. So I will just share my screen. And I'll try not to be too technical, because I know we've got a mix of healthcare professionals and non-healthcare professionals on the call. So as Lydia has kindly set the scene, our public health colleagues are doing an absolutely amazing job when it comes to kind of promoting all the cardiovascular disease risk factors and promoting screening to try and make sure that we're capturing as many people that have high blood pressure particularly and might not know, because it often comes without any symptoms, so people wouldn't know unless a cardiovascular disease happened, or they opportunistically were found or routinely found through a screening process or a blood pressure check. In terms of the national levers, I know Lydia touched on this earlier, so NHS England set us some operational planning targets every year. And this is what this looks like for this year. So there's two targets. One is around reducing inequalities in line with the Core 20+5 approach for adults and children and young people. So hypertension or high blood pressure and cholesterol are both within the Core 20+5, and that's why we focus on them so much. And also to increase the percentage of patients with hypertension, so that's diagnosed high blood pressure, treated according to NICE guidance, and also increase the percentage with GP recorded cardiovascular disease who have their cholesterol levels managed to NICE guidance. Those targets have changed for this year. So last year there was a number of a percentage attached to those metrics, and the cholesterol one used to be one around Q risk, which is an algorithm that identifies your risk of having a cardiovascular disease in the next 10 years. And that was for anybody over 20% risk to be on a statin, so a cholesterol medication to reduce your cholesterol. They've taken that away now and looked at the level of, I suppose, the level of optimization or trying to get people to target that we know have got cardiovascular disease and are taking statins or whatever other cholesterol medications are available. So what does the data across West Yorkshire tell us? So Lydia kindly mentioned CVD Prevent. CVD Prevent is a national audit, and we've got quite a high percentage. I think it's about 96% of our GP practices that are signed up to submit data to CVD Prevent. It is usually at least 3 months old when we access it. So the data that you can see on the screen now is up to the end of December. So we are still quite a way off receiving the end of March data. And we know that there's lots of activity towards the end of the QAF year. So chances are some of these metrics might be even better when we get the next data. So the first target is all around people that we know that have got atrial fibrillation and been diagnosed, being treated with an anticoagulant. So that's a type of medication that supports people with AF, and that reduces your risk of having a stroke. So what we know is 1 in 5 people, if they aren't anticoagulated and they've got AF, will have a stroke, and they are likely to be more disabling, or could contribute to a cardiovascular disease death. So it's really important that those patients are detected, and you can do that through a really easy pulse check, or if you've got some equipment to do that, such as the My Diagnostic device or other atrial fibrillation detection devices, and then anticoagulate the patients. So there's some data there around Leeds and West Yorkshire. They're quite similar in performance levels. And then we've got one around prevalence of GP recorded hypertension. So that's kind of how many people we know about in our population that have got hypertension. And West Yorkshire are at 18.4% and Leeds are at 16.62%. Now, interestingly, we know that there's around 600,000 people in West Yorkshire that have got high blood pressure, but we only actually know about 387,000 of them. So in theory, that the higher that prevalence goes, the better, because we're finding the people, but actually that's worse because it means more people have got high blood pressure. But it's better that we find them and treat them than not find them at all. So we've just had some interesting data to say since 2022, our hypertension register across West Yorkshire has increased by 87,000 people, which is staggering when it comes to managing that caseload. And then we've got some other data around GP recorded hypertension with a blood pressure reading. So the project that Lydia mentioned before, where they were trying to get people to record a blood pressure check, it's really important for high risk groups that we screen for blood pressure. And we ideally for people that are known hypertension patients, that we do that at least within a 12-month period to make sure that we're monitoring them accordingly. And then alongside that we make sure that those people are optimised, so they're within a particular range that's classed as a better blood pressure measurement, which is 120/80 for most people. That's a healthy range. The nice target for people with hypertension is 140/90, unless you're over 80, and then it's slightly higher. And last year our target was 80%. So as you will see by this, we're all kind of still a way off getting there, but we are improving. So I think we've gone up in a couple of years from about 62% to 69%, but there's still some work to do. And then we've got the Q risk one that I just mentioned. So that's relatively good, 64% across the system and 66% in Leeds, which is great. And this bottom one is a measurement from a blood test that measures your cholesterol levels for the people that we know about that have got cardiovascular disease and are treated for high cholesterol. And there's not a target for that, it's just to increase it. So I'll move on to the next one. So in terms of West Yorkshire projects, the link on the bottom of this is that website that I've just popped in the chat, but this will come out as part of the slides. We work really well across the system. Cardiovascular disease prevention programme has been in place for probably just over two years now, 2.5 years, something like that. And then last year we also inherited the cardiac programme of work. So that's focused around more secondary care, so the hospitals, and things like heart failure and cardiac rehabilitation as well. So those came to us from NHS England. They used to be held in some networks there. Across the system, we've done some really positive system-wide work on some big campaigns, and Leeds have been really supportive of that, and Leeds Health Awareness Team have been part of that. So delivering outreach work for Know Your Numbers Week, which happens the first full week in September each year. We developed a toolkit and worked as a system to deliver outreach screening, thinking about workplaces and things like that across the system, aligning all the resources that Lydia's just talked about in Leeds. World Hypertension Day, which is in May, so that's the 17th of May. I know Liz is going to talk to you about some work they're doing, but yeah, if you've got any opportunities and you want to think about how you could deliver some blood pressure screening and promotion, World Hypertension Day is just around the corner. And also the West Yorkshire Healthy Hearts initiatives, which I'll come on to in a little while. We've had lots of other kind of things across the system. So we bring together a community of practice for CVD prevention clinical leads that are based within each PCN. That's a clinically led forum looking at all sorts of different things to try and improve cardiovascular disease together across the system. We've led some health inequalities projects. We've led a project around urine testing for kidney disease, because people that have got high blood pressure, hypertension are at more risk of kidney disease, and sometimes they don't know that. Lots around secondary prevention. So that might be a term that you've heard before. So that's the people that are at higher risk, or they've been diagnosed with a cardiovascular disease condition and we're trying to stop them having another one. So for example, a stroke. And then we've just launched something called the Yorkshire and Humber Heart Failure Academy, which I can pop links into the chat about if that's any help. So that's to support patients and to support primary care, particularly in the better detection of heart failure. 80% of people that are diagnosed with heart failure happens in the hospital. So we're doing lots of work with Pumping Marvellous, which is a heart failure charity, around trying to help people understand and recognise the symptoms and the signs of heart failure that could need exploring. We did a big rugby campaign and supported that in Leeds through the cricket club, the county cricket club, to deliver some basic health screening to people that were attending the rugby and the cricket matches. That went really well. I think we delivered about 200 health screens. And there was one guy that worked in Halifax and he actually had really high blood pressure and he ended up in hospital, bless him, for 5 days, but is on the road to recovery now, which is wonderful. So that's just kind of some snippets about what we're doing. Some other projects. So you may have heard about a project called AF Way, which was an atrial fibrillation project. If any of you know Emily Turner, she's our CVD prevention clinical lead and is a pharmacist by background that used to work in Leeds ICB and in the hospitals in Leeds. So Leeds did this project first, which was wonderful, and they are still kind of promoting the value of that project. So we scaled this work through some funding that we received from a pharmaceutical grant supported through NHS England, and we were lucky enough to employ 2 consultant pharmacists, one that worked in Leeds Teaching Hospital Trust and one that worked in Calderdale, to support primary care in general, to kind of detect more people with AF, to make sure that they were on the right medication, and to try and stop that risk of stroke for any of those people that needed the right levels of anticoagulation. There's lots of links in here, so we will send those slides out, but we screened 1,735 people for AF and 29 of them came back positive, so were signposted into primary care for further clinical investigations. We developed a tool that helped primary care support understanding whether somebody was on the right level of a dose of a drug for the direct oral anticoagulants, and then we provided some education and training to 490 healthcare professionals and support staff and delivered an advice and guidance service. So we're just in the moment in the process of evaluating that project, and that'll be available to be shared if anybody's interested in reading more about that in the coming months. Another West Yorkshire project, so the Healthy Hearts. So we had a Healthy Hearts guideline that was around uncomplicated hypertension, and we wanted to bring that up to date with the latest evidence base. So this is just in the process of being signed off at the moment. It's a lot more detailed than it used to be. It's covering a lot more conditions, but hopefully that will be of value to the healthcare professionals to support the patients. We've engaged with over 300 healthcare professionals across the system between primary care and secondary care to try and make sure that this will work for people. So we're excited about getting this launched over the next few months once it's been over its final sign-off process. And just a point there about even a small reduction, so even a reduction of 5 in somebody's systolic blood pressure, so that's the top number if you do a blood pressure reading when somebody's heart's classed as being under pressure, can reduce major cardiovascular disease by 10%. So you can make some real big differences by some small changes, as Lydia mentioned, lots of it with lifestyle advice. The other thing that we've worked on is a Healthy Hearts dashboard. So that's been led by the business intelligence team in Leeds, and they're collecting data from primary care systems. So similar to what CVD Prevent does, but delivered a little bit quicker, so you can get more fast real-time data to determine what you need to do in those practices, PCNs, or at place level. It's updated each quarter. It's got health inequalities lens that you can look at by male or female. You can look at different ethnicity groups, you can look at deprivation, and you can look at age bands to see how many people across your practice or your PCN, or even wider than that across Leeds, may need some further support. So that's a good tool for some quality improvement. There is a link to register for access to that dashboard if you are interested and you've not already done that. Again, we'll share that out with the slide deck, but we do encourage as many people to sign up for that as possible. It's been a really good piece of work and we want to make sure that people know it's there to be used. I think that's everything from me. Thank you.
Thank you, Laura. Great. I really like the look of that dashboard. I'd like to have a look at that. Thank you. That's been great. Any questions for Laura? There'll also be time later as well, but if you've got a question, do just pop it in the chat or put your hand up. Have we got any? Just looking at the great. Thank you. Okay, so let's move on to Liz, who's well ahead of me and has already shared her screen.
Thank you, Camilla. Hi, yeah, good afternoon, everybody. My name's Liz. I'm here with colleagues as well. Lauren Brown, who's one of my colleagues, and then Lauren Pax as well, who's from Confed, who's been supporting some of our work. So I just want to share with you a few slides and a bit of a discussion around how we've been how we've over the last couple of years been doing work around CVD, around prevention, case finding and treating, and what our approach is. I think, oh, why won't my slides move on? There we go. I think what's really important first is to explain a lot of this activity and this work we do as a PCN is actually directed through our Health Population Management Hub. Originally, about 3 years ago, when we started work on doing physical health checks for SMI, it was just myself and one colleague, and we're a nine staff hub, and that includes clinical staff, myself, administrators, nutritionalists and care coordinators as well, and Lauren, who's with me today, is a care coordinator. Our health population management approach and our hub is all about improving population health through data-driven planning and risk stratification. The delivery of this proactive care is there to optimise health outcomes, and that means focusing on interventions to prevent illness, reduce risk of unplanned care, both secondary unplanned care and GP care, and most importantly, to address our health inequalities. We have a cross-fertilisation mantra in our team, which means we're all about fostering collaboration as an MDT and being being very innovative, looking at innovation all the time. And we pride ourselves on being very agile to be able to accelerate deliverables across multiple focus areas at the same time. So as well as CVD, we've also got a women's hub within our team as well. And we've also got a primary focus on pre-diabetes and diabetes as well. We've got a very partnership approach, so we work across lots of NHS organisations, public health services, patient groups, communities, and then work with public health as well on a lot of work that we do. So our approach then, so what we actually pride ourselves on and some of our principles, and this is from our experience over the last couple of years, but also through recent listening groups that we've done through the hub, is that we are, as a team, community based. So we support practices with a lot of work, but our main focus is about being community based. So that means no appointment needed, drop in, opportunistic and flexible booking if required or preferred. So we go out basically into community and into community settings, so community centres, religious spaces, supermarkets, we pound the streets, we do barbers, we do local shops, anywhere that you think that you may be able to find some of our BHR patients, you will often see my team out there. We do different sites that cover the whole area of BHR, right through from Chapeltown Road right down to obviously Bermintoff's area as well. What we know that our patients like and what we absolutely focus on is that our patients like advice and feedback on the day. So we frequently get feedback that getting GP appointments and access to general practice is really challenging and really difficult. You might come along for a test or a procedure and you might not necessarily get feedback on the day. You might be brought back for multiple appointments. So we pride ourselves as a team that we are able to give direct advice and direct feedback. And this makes it, and having point of care testing, which means that we can test out in the community and we're not reliant on taking blood tests and waiting for results to come back. We can actually serve that approach and serve that request from our patients. Our processes also enable follow-up appointments, so we can arrange these directly with our healthcare professionals that work in the hub, and we can complete in NHS health checks to ensure that patients have a positive experience. So if they see us in the community, we will, and if we need to bring these patients back for any reason into their general practice, they will be seeing the health population management hub team in their own respective practice. So there's continuity, the patient's not repeating, they're already built and establish that trust with that person who's delivering that care. And we know that that is really, really important for our patients. We use communication methods, word of mouth, from trusted and influential people. We know that that works. So it's not always digital, but we use WhatsApp, we use posters, we go to events, we go and see people. And we know that we do a lot of work with established groups and community planned events that might already be happening. One of the most important approaches for us is language support. So we ensure that is embedded right from booking to following up. So from first contact right to any follow-up processes that might need to happen. And we have as a team a desire for a less holistic and joint up care. So if we're offering health checks, we're also doing case finding for BPs. If the patient's not eligible for a health check, we do a whole package. So we do educational sessions. So we ensure that every contact that we have out there in our community counts. And that's really, really important. We're also in the process as well as building, champions. So we've got NHS Health Check champions, and we've just actually set on 3 volunteers as well. And why we've done that is predominantly, I've already mentioned that we have 9 people working within my team. All 9 of us are of white ethnicity, and all 9 of us are female as well. So we are absolutely understand that need for some more diversity in our team. So we have recently gone out for volunteers to be able to support us when we're out in these communities and working with these diverse communities that we've got in BHR. So we have 5 different interventions, and you'll have heard some of these already from Lydia and Laura, but we have taken an approach of these 5 sort of initiatives for CVD and for heart health. Quite recently, as in this year, so over the last few months, we have been offering community NHS health checks, and this supports case finding and prevention for CVD. So as somebody has already said, the NHS health check screen for heart disease, diabetes, kidney disease, stroke and dementia. And we can deliver these in a community because we use that point of care testing that we've already that I've already described, which means it's not a venous blood, it is a pinprick blood testing, and it gives that instant results. As a priority, we target our most at-risk communities. These risks are not just on clinical need, but also on factors like our underserved populations. So we're ensuring that we're working in our most diverse communities, but also our underserved populations. So we've got an initiative at the moment where we're working with carers leave. Carers and people with dependents find it really, really difficult to get into general practice. So we've done a large piece of work working with carers leave, where we're inviting carers along to a community event to either get their NHS health check if they're eligible. If not, we will be doing case finding for hypertension, cholesterol and AF. The team offer follow-up appointments and navigate patient to pathways for treatment and support. So because my team, as I've said before, is really, really agile, and we all work across all of our 12 practices, we are able to access clinical records on the day. We are able to book appointments on the day. We are able to provide that real sort of clinical pathway. So unlike maybe going to your community pharmacy to get a BP, and don't get me wrong, I'm not saying this is not a good approach, and it can do masses. What we're able to do is screen somebody's blood pressure, initiate a 7-day diagnostic home BP monitoring or ambulant BP monitoring, because we've got abilities to do that. We bring patients back to our clinics. We monitor their BP, have a look at their average BP over that period of time. And if they need to go onto a pathway because they're now being diagnosed as hypertensive, we bring them back into my clinicians' appointments. So it necessarily doesn't touch the general practice. If we, in one of our events, find a patient that is hypertensive, we've got direct access into PCN pharmacy appointments as well, where we can titrate and have a look at medicine compliance. So we've done around, since January of this year, we've done 6 community events. Out of them 6 community events, we have completed 23 community NHS health checks. And of them community NHS health checks, we've found 3 patients that have needed follow-up in general practice. So their pinpoint finger prick has shown they may be at risk of either diabetes or at risk of cholesterol, and we've brought them back and done deep venous bloods. We've actually not found anybody that has needed to progress onto a pathway of treatment. Of all of them 3 that we followed, their actual venous bloods were normal when they presented and they came back to us. So that's about 13% of patients seen have received an abnormal result. And as you can see, the total numbers of patients that we see, we obviously deliver NHS health checks, BP, AF, and cholesterol testing as well, as you can see from that chart. So we've done numerous different events. We've been into Shakespeare Primary School. We've been to the One Centre, which is just behind Shakespeare. We've done community events, so that's out of working hours as well. So that's doing sessions on Saturdays. We do regular sessions at the Regional Centre and the Compton Centre. And I'm going to tell you where else we're going to be doing some events as well on the next slide. So for May, what we got planned. So for May, we have got a Women's Health Day, which is going to be delivered next door to Bellbrook Surgery. That's on the Wednesday, the 21st of May. Again, as I've said, we're making every contact count. So this is to support women's health, but whilst we'll be doing hypertension case finding, AF case finding, and for eligible people delivering NHS health checks. We'll also be doing cervical screening and STI testing and contraception advice as well, working with all our care partners that you see below. We've partnered up with the National Institute for Health Research as well, and we're targeting our Black community that may have sickle cell anemia. So we're trying to encourage our patients to get involved with research around sickle cell anemia. And when patients are here to do the lunch and learn and find out more about sickle cell, we're also going to be offering NHS health checks. On the 16th of May, we have partnered up with the Jamaican Society, and we're doing a health day for the Jamaican Society. We will be offering NHS health checks, but they've also asked us to do presentations and present on understanding diabetes, risk factors and prevention, how to manage blood pressure, what your numbers are, how to know your numbers. And they've also asked for some advice and some education around prostate cancer awareness as well. So that day is very tailored to their needs. And then the last one, which I've already mentioned, is the carers lead work that we've been doing. So that will be delivered at Compton Centre and Regional Centre, and that's a drop-in session where you can bring your dependents along and you can come and get your NHS health check. So they're just May dates. We've also got events booked for June, July and August throughout the year as well. So that's number one. So that's the NHS health checks. The other thing that we've got is we've also got point of care testing, which is called PopDoc for patients that are not eligible for an NHS health check. And this supports, again, case finding and prevention. So this is not doing the HbA1c, so it's not checking for pre-diabetes. This is purely just checking somebody's lipids, so their cholesterol levels. So we look at good cholesterol, bad cholesterol, fats in the blood, overall cholesterol, and we also give you a ratio, so a cholesterol ratio, which gives you an indication of your cardiovascular health as well. We offer PopDoc testing to any patients registered in BHR. We're targeting at the moment patients aged between 30 and 40 who do not have a long-term condition, so won't have had an annual NHS check for their annual review. Any patients 40 plus that do have a long-term condition, so that makes them ineligible for an NHS health check, but have not had their health review in the last 12 months, so they've not attended, we are able to do lipid testing for them. And all of these patients that we are screening must not be already taking lipids, so must not already be known to their general practice. This is preventative work rather than treating work. So number 3, so we've already spoke about case finding, but we've been doing hypertension case finding for the last 3 years. This is done by my clinicians and my care coordinators in the team. This is all about preventing and treating. So often what we find is that we do case finding for hypertension. If we find somebody that needs to be monitored for 7 days, either with home monitoring or ambulatory monitoring, we set them up on the day with that equipment and send them away and then bring them back for the results. Often my team will go out and pick the machines up from their home or their workplace or a agreed suitable venue, doesn't necessarily need to come back to their GPs. And then we will see them if they are diagnosed with hypertension, and we will put them on their correct pathway, working very closely with their general practice. In these hypertension case finding, we also will do people that are known to have hypertension, and if there are BPs raised on the day, again, we can give them home monitoring BP machine to go away and monitor that and then bring that back. We also can refer patients in straight directly on the day into PCN pharmacy slots, so they can have an appointment with the pharmacy around medicines adherence and, if necessary, titration, so any changes to medication that they need. As we've already mentioned, hypertension case finding day is on the 17th, which is actually a SAT date. So we're choosing to do our hypertension case finding day on the 16th. And what we will be doing on the 16th, the team will be visible around Air Hills Road and Roundhay Road. They will be visiting local businesses. We've got chairs, we've got tables. We will be sitting on street corners, basically targeting anybody that needs their BP doing, and we don't turn away patients that may not be registered in our practice. We will we will do their BP and then use the resources that Lydia's shown us, where we give them their written BP and they can take that to their general practice. We have found patients that are high, and we have had instances where we've had to send people directly to A&E because they've had a raised blood pressure, and we've also had to support patients getting a same-day appointment in their general practice due to having high BPs as well. We also use the My Diagnostic Stick that Laura mentioned, which is the atrial fibrillation case finding. So as you can see, one of my colleagues there is using the AF stick. We call it the AF stick because basically it looks like a stick. You put both hands on it, and that actually does a simple ECG that shows whether the patient's got a arrhythmia and got an abnormal pulse, and we've got standard operation procedures in place that triggers what we need to do from a case finding point of view if we trigger anybody with an AF. We have been doing this for the last 6-7 months, and we actually haven't found anybody with AF at the moment, apart from one of our colleagues who was actually on Laura, who was actually one of our colleagues. She looked like she'd got AF, but when she went to see a GP, it's because she's too fit and needs to stop going to the gym as much, so that's why she had a regular heart rate. So that's it for that. And then last but not least, we also run hypertension group educational sessions as well, which supports treatment of patients that might be hypertensive. So the Health Population Management Hub run these education sessions for patients that are diagnosed with a high blood pressure. We provide education on what is hypertension, knowing your numbers, provide diet and lifestyle advice to support patients to lower their blood pressure. Patients can either self-refer in to the group sessions or can be referred from a member of staff from all of our 12 practices. You don't need to be newly diagnosed. You can actually be not to target. Anybody is welcome to these sessions. So it could be your first session for education, but it could be a follow-up session and a refresh on knowledge. And as a team, we also use risk stratification data where we invite patients from practices that we know that are not to target. So that's it for me. I know I probably spoke really, really fast there, but I just wanted to give, I'll stop sharing, but I just wanted to give opportunity to either either Lauren Brown, who's my care coordinator in my team, and Lauren Parks from Confed as well, if they want to add anything. It'd be really good, Lauren, if you just explain your sort of background and who you are and how we've upskilled you to do all of this work.
Hi everybody, I'm Lauren. So I've been with Health Population Management Hub for about a year now, and I came from like A-level sixth form, so I knew absolutely nothing apart from working in a pharmacy while I were at college. So I've done everything I've learned with Liz. It's been really good working with our community because at the moment when we're like, obviously it's got a bit warmer, so we're walking up and down the lane a bit more. They recognise you, so you've built that rapport with the patients, and then that builds trust with their GP practices, so they attend their appointments a bit more. But we do struggle with that still when we've got as groups. They are hard to engage with. We send a lot of invites out and sometimes we don't get much back, but the ones that do attend engage really, really well with the information, and you can see it's making a difference with them engaging with their overall health, which is really, really good to see.
Thanks, Lauren. Courtney, I know you're on, but I don't know if Lauren's on as well.
Yeah, no, she's unable to attend today. She's had a last minute clash, so apologies. Yeah, I just want to kind of emphasise. So I've been working with Liz and Lauren with the NHS Health Check programme. I know a couple of months ago, me and Lauren did do a presentation on NHS Health Checks, but do you want to emphasise, Joe, the amazing work that they're all doing? It is really nice. I don't come from the area, so it's really nice to go into that area and, see that the work that they're doing, going to these listening groups, working with the different third sector partners. We're working with the Jamaican Society, and obviously Liz spoke about some that they're already doing, and it's just really nice, and the community is really lovely. You can see, like Lauren said, that rapport that you're building and seeing people come back to multiple events. It's really, really nice. So yeah, I just wanted to kind of put the emphasis on that, really. So yeah, well done, team.
Thank you. I don't know if anybody's got any questions. I'm trying to look in the chat now.
Yeah, Sherry Marshall, hello.
Yeah, hello, hi. So I'm the customer service manager for East North East. Reginald Compton is one of my sites. We do have wellbeing hubs, which were initially made for maternity services, but they are underused at the moment. So I'm just wondering if that is something what you'd like to do moving forward. They are bookable, so it would be sent to East room bookings for them to be booked. But there's a bed in there, there's a sink in there, there's lots of different kind of things in there. But it is a NHS setting, but based within the community hub. Because they are underused, I just thought it'd be really, really good if you ever did want to use them to let us know about that.
Yeah, we use them once a month. So we've got Mondays and Tuesday where we schedule them out once a month. So any patients that we see at a community event and maybe they don't have the opportunity or the time to have their NHS health check there and then, or they prefer to have it pre-booked in, which is absolutely fine. We have regular clinics both in the Compton and Reginald Centre. And that's a bookable appointment. So we man them using the pods.
Brilliant. If you need to use them more, let us know.
You shouldn't say that to me.
They are underused at the moment, so I just thought I'd add that. Thank you very much.
Thanks, Sherry. And Councillor Manaka, hello.
Hello, hi everyone, and thank you, Liz and colleagues, for a wonderful presentation. Liz, you've mentioned, I'm just going over my notes here. You've mentioned sickle cell.
Yeah.
It so happens that I've had a constituent contacting me just yesterday, who suffers from it.
Okay.
And I'm just wondering whether can I email you that you get in contact with, because there's a lot that she's kind of not mentioning. And I said to her, you know what, tomorrow I do have a meeting, and so let's see what I can get from that. I was going to mention it that I do need someone to help me with this constituent. So I'm quite pleased that you actually mentioned something that I was confused what I need to do with that information. But thank you, and I will. If I could just email you, please, and you make contact with her. Is that all right?
Yes,
Lovely. Thank you.
Sorry, I had my mute on. Sorry. That was handy, wasn't it, Councillor Manaka? Courtney, you've got your hand up. Thanks.
Yes, so it was just linking in with Sherry about the Reginald and Compton. So where Lydia, going back a few presentations, Lydia mentioned about doing some NHS health check videos. So just while we're on the conversation, we are actually using those pods for the NHS health check videos, and what that'll be is a healthcare professional and some volunteers we're doing the videos in different languages, so we are already utilizing that. But I did just want to raise to everybody in the room that we are still looking for some volunteers for Urdu speaking languages. So if there's anybody that knows any volunteers, so I just thought it linked in with what you were saying about the pod, so I just thought I'd jump in there. Thank you.
Excellent, thanks for letting us know that.
Yeah, no, that's fine. Councillor, did you want to come back?
Yes, please. Courtney, possibly. Oh, sorry, I'm not on my camera again. Sorry. Courtney, I'm not sure if you are familiar with the Leeds Refugee Forum, where maybe they could be of help for you with Urdu languages, maybe.
Perfect. Yeah, no, that's great. Thank you. I'll reach out.
Okay, there is Mr. Ali Makboob there, so possibly if you just make contact, I think he might be able to help.
Yeah, great.
Okay, all right, thank you.
Thank you. Rachel, hiya.
Hiya, thanks, great presentations, guys. Really strong commitment to partnership working. Are there any groups that you're still struggling maybe to engage with? I'm just conscious we've got 30 to 40 partners here on the call that might be able to sort of signpost opportunities.
So our next events will be we're going to be targeting food banks, so we're going to be doing that in June, July, and then later on in summer we are going to look at our Romanian population. We've got quite a high population in the Bellbrook, sort of Ashton View, Conway region. So we would like to be able to do some events there, but we're looking at doing that in the summer. So I have linked into public health around doing that, but at the moment we've been targeting our South Asian and African population, and obviously our carers as well. So later on in the summer we're going to be looking at our Romanian population. So if anybody has got any sort of ideas or any links to support that, we're looking at community venues, community events where we can put on sort of health events for NHS health checks, case finding, etc., etc. And, it'd be really great whenever we do the posters or any of the events that people just share them as wide as possible. The more people, the better that attend.
Absolutely. Thank you. Great. If we haven't got any more questions in the bigger group, we're going to move into some breakout groups now. I'm thinking somebody, not me, is going to be pressing a button, and then we'll all arrive in the breakout groups, and then we'll come back here for a few minutes at the end.
Thanks, Camilla. Absa's just busy teeing that up for us. Thank you.